Hi, I'm Marta Benavides. It's time for Socialife. Coming up, weather adding to COVID-19 challenges. Valley hospitals are being stretched to the limit. We're checking in with Hidalgo County Medical Authority, Dr. Ivan Melendez, on the situation right here at home. Getting out to vote. How is the process going to work this election year? We are hearing from an organization called ACCT and their efforts to make sure everyone's voice is counted. And we're cooking up a delicious red snapper with our friends from Santa Fe Steakhouse. Don't go away. More Socialife. We'll be right back.
Healthcare is being challenged. DHR Health is meeting that challenge by providing the highest standards of care and safety, caring for our patients, and caring for our community. We're bringing the vast resources of DHR Health's medical campus, its 740 doctors, 5,500 employees, and over 70 satellite clinics in a coordinated effort to fight the spread of the coronavirus in our area. Now more than ever, DHR Health, for you, for life.
Need help after COVID-19? Get support and answers on financial assistance, utility hardship assistance, state and federal funding, workplace safety planning, and more. Free for Pharr residents and business owners only. Call 402-4311 to set up your appointment today.
Hello, Martha and Socialife. May peace and blessings be upon everyone. In these uncertain times and with the recent hurricane, it is very easy for many of us to fall into despair and hopelessness. But we learn from our religion that God teaches us never lose hope in God. So when we look at our life and we look at the things we go through, we understand and we learn that life has many, many challenges, and every human being is going through a challenge of his own. Every person has a different challenge on a daily basis, from relationships, from family, financial. But faith teaches us with hardship, there is ease. Indeed, with hardship, there is ease. In this chapter number 94, verse number 5 and 6 from the Holy Quran. And when we look, if we decide to look at the world, we can see it in two different ways: as a glass half full or half empty. But if we look at life through a specific type of lens, the lens of gratitude, we notice that gratitude is very, very special and is given as a blessing to us from God. We all can show gratitude to the people we love, our spouses, our family, our friends. We can be thankful to God for giving us these people in our lives, and we can be thankful for everything He has given us. Looking at life through the lens of gratitude not only decreases anxiety and stress, but also makes life beautiful and lets a person cherish the moments he has. And it helps us see the good things in life in every situation. So let us get together and make a list of things to be thankful for and thank God for everything He has given us. May God's peace and blessing be upon us all. Thank you, Martha, and thank you, Socialife. Back to you.
Thank you so much for your message of hope. It feels like a double punch for South Texas as our area continues to be a COVID-19 hotspot. That, coupled with the damage left behind by Hurricane Hannah over the weekend, has made it even more challenging. To bring us an update on the situation right here at home, we have Hidalgo County Health Authority, Dr. Ivan Melendez. Thank you, Dr. Melendez, for being so generous with your time. We hate to take you away from patients and colleagues who need you right now, but I think this is an important conversation that we need to have to drive the message home that you know, the level of seriousness, it's at another level, and we need to get everyone's attention right now.
Yeah, no, Martha, thank you for having me as a health authority. One of my responsibilities, of course, is to make information available to our community. And as you know, knowledge is power. One day last week, we had 1,000 people die, and 50 of those 1,000 people were in Hidalgo County, 50. So we were the hotspot of a hotspot of a hotspot. In the entire world, our numbers were most impressive. We're about to surpass New York City at its worst time. And so the numbers went from 12, 13 people dying in a 2.5-month period when we started to 49 one day and 30s most days. So we went from 13 in a couple of months to 30 in one morning. So absolutely, our numbers have been dramatically increased. And in reference to your entry comments, you're right. We want to stay away from cliches, but you're right. It was a double whammy. It was a perfect storm for us when Hannah rolled in. As you know, most of us who have been living here, heck, I've been living here since the 60s. Since I'm old enough, I remember Beulah, that's how old I am. And so for us, when we hear Category 1 hurricanes, this one, as you know, had significant structural damage to almost all homes, businesses, and of course the hospitals are not exempt from Mother Nature. Temporary flooding. So you're trying to do procedures, putting lines in someone's heart or putting a chest tube in, and you look below you and there's a couple of inches of water on the floor. I had a patient whose life depended on an electrically powered oxygen concentrator. And that's the reason that she was home, because she had an apparatus that would produce enough oxygen to keep her out of the hospital. Well, when your lights go out for 20 hours, 18 hours, 24 hours, it becomes a critical scenario.
Of course.
So like myself, at 1 o'clock in the morning, she's driving around in the middle of the storm, trying to find a place where she can plug in her oxygen concentrator. And she goes to her mother's home, where in the garage, while in her car, because she's so afraid to infect her family members, her siblings, she's literally in the garage during a hurricane, plugged into the wall with her oxygen supply in order to not infect her family members and not to perish. We have these particular situations that no one can really identify until you're living it. And so during the storm, I have a nurse who calls me and tells me the numbers, the blood work numbers of a particular patient. These numbers would immediately indicate that the person needs to be placed on life support. It's as if your temperature inside your house is 102 degrees. That immediately indicates that you have to turn on the air conditioner. But knowing that she's 58 and she's still asking for food, she's saying, I'm really hungry, can I have something to eat? You scratch your head and you say, sick people don't ask for food. And yet these numbers are horrible. What do I do? So I said, let me get there because I need to talk to her. Because as you know, that there are a lot of numbers, a lot of data. But when you look at someone's eyes, it's the decision is so ambiguous. I can just give you the data and then you decide which is the way to go, because you're 58 years old and you're completely alert. And so I asked the nurse to increase her oxygen, and then I'd run down to the hospital during the storm again so I could talk to her directly and see which way to go. So when I was trying to back out my car, I had noticed 3 trees had fallen. So I had to go back inside and get a power saw and kind of cut my way through some trees in order for me to make it to the hospital. Well, by the time I got to the hospital, the patient had been placed on life support by the emergency room physician and by the nurse. The emergency room physician, he's so busy. He just gets a call about the number. He runs and reacts and goes back to the emergency department. So I think this is another example that most people do not understand of how impactful the storm was. Decisions were being made based on numbers and not on humanity, because it was such a difficulty going to and fro to the hospital. As you know, we have a lot of guest nurses that have come in from out of the state, thanks to the federal and the state government. And the nurses were not able to get to the hospital. So some nurses work for 18 to 20 hours until they got relief. And so by all measures, whether it's the human impact of a person living at home trying to get electricity for life-saving apparatuses, to the decision-making that really is made by the criteria of humanity, not the criteria of mathematics, to the availability of the hospital personnel, to the infrastructure being attacked by Mother Nature, it was just a calamity. And so it's very difficult for people to understand unless you're living it.
And you're right. No one truly understands unless you are being directly affected by it, Dr. Melendez. You're right about that. So how do we handle the situation right now? And do you feel, as a medical professional, do you feel that you're being supported with all the necessary things that you need to help manage this crisis?
That's a good question. It's actually 2 good questions. So I guess the first question, like anything else, how do you impart truth? How do you impart knowledge to people that are not in this field, that are not directly seeing people suffering every day from this disease? And that's, of course, is through education. And that's, I'm assuming, one of the reasons why this show is on the air and why you've dedicated such time and energy for it. So we have the window to teach people, to educate them, to give them the information. I'm still amazed about the level of conspiracy theory and denial of a lot of folks. When I first, a couple of months ago, started getting involved with the public information, I would make the mistakes of pushing the comment button when you're on a particular show. Oh my God, I never realized the detachment of owning your comments when you're doing it on the internet. Mm-hmm. You're completely detached, and so people are cruel and ill-informed and question motives. So let me debunk a couple. The first one, as you're driving down the expressway and you're driving by our hospitals, whether it be McAllen Medical Center, Rio Grande Regional Hospital, Mission Hospital, Cornerstone Hospital, Edinburg Regional, Knapp Hospital, Heart Hospital, as you're driving by, what you usually see are very well-appointed buildings, nice landscaping on the outside. And the first thing you'll say is, oh, there's no cars here. I don't see any cars. That's unusual. That's if you're paying attention. There are no cars because there's no family allowed. There's no visitors allowed. Nobody's allowed to go in there except the patient and the people who work there.
Right.
And that's why these folks are dying by themselves, holding the hands of strangers. Second thing, if you could wear the eyeglasses that when we were children, way before your time, we would order out of the comic books so that we could have x-ray vision. And if you had x-ray visions, you could see through the walls. What you would see warehouses of people. You could tear the walls apart. You would see warehouses of people, 30, 40, 50 people lying on stretchers, connected to life support apparatuses, prone. You would see people running around like ants dressed in astronaut uniforms. You would see healthcare workers crying. You would see not only stethoscopes, but the telephone. The telephone has become just as important as a stethoscope so that we can have a visual image with the family members of our patients. And you would see the reality of it. You would see people that would be in plastic bags. You would see the funeral folks coming in to retrieve the bodies. Before a typical night, a funeral transport person might pick up 8 to 12 bodies. And now they're picking up those same 8 to 12 bodies, plus another 30 to 40. And so you would see this hustle and bustle of human beings that are taking care of people who have just died or are dying. And so quickly, people's idea of conspiracy theory, of exaggeration of the numbers, of exaggerating the COVID diagnosis for financial reimbursement, of falsifying information so that whatever government or political agency could beef up their numbers. You would do away with the pharmacy conspiracy theory that they're holding back the treatment so that they can continue to sell their medications when a disease could easily be cured by hydroxychloroquine or easily be cured by an inhaled steroid. This is all a bunch of nonsense. This is nonsense. You know, I see folks on the internet, I see people with COVID fatigue because of all the information. And let me tell you, if these silver bullets exist, we'd be using them. Do you think that for a moment, my 6th grade teacher that I had to intubate and died, do you think for a moment that a nurse I've been working for with 25 to 30 years that's dying in my arms? Do you think that my mentor, one of my doctors who died today, do you think that my mom's best friend and my neighbor, who I had to put on life support and eventually physically put her in a body bag and play to her cadaver her son's message on a phone? Do you think that if there was a silver bullet, I wouldn't be using it? That for some financial reason or some conspiracy theory, I would put our community to pain and suffering so I can make $5 more on a coating? So to these people that believe this, to these people that continue to perpetuate this, I invite them to come and to run at one of the units, and you can see firsthand what the truth is. You know, 40% of our population is uninsured or underinsured. There is no money in taking care of folks with COVID. There is no financial motivation to put people in the hospital. There is no margin of fiscal profit for the doctors and for the hospitals to take care of folks. On the contrary, many of the physicians and many of the healthcare facilities are in tremendous financial duress because essentially it's all COVID. The reality of this, the truth of it, is that we wake up, we go to work, we have 20 to 30 people that we're seeing, an average physician in the hospital, of which of those 30, maybe 26 have COVID. Of those 26, you know that 18 of them are probably going to die. And then as the days go by and the week goes by, those people go to heaven and you have a new set of people. And so the faces remain the same. It's just the names that change. And so this is a never been seen in my lifetime. And I started with HIV in the 1980s. That's how old I am. I started taking care of patients in the 1980s with HIV. I was blessed to be a flight surgeon in the military. So I was in the Green Zone and Iraq and Fallujah and Buka and the Iraqi War. But I've never in my 30 plus years of being a physician have personally lived such human drama, such human pain. And to consider that some people who would still think that this is somehow exaggerated just baffles me.
It's heartbreaking. You know,
Heartbreaking.
I don't even know how else to put it. It's hard to say, I'm sorry. You know, it's tough. I can't imagine the toll this has taken on you and your colleagues and everybody on the front lines that are there giving everybody a fighting chance. Are you encouraged by news that pharmaceutical companies are now in clinical trials for a vaccine, Dr. Melendez?
A very good question, and let's answer it this way. One is, and before we answer this, Martha, real quickly, yes, we're getting the resources from the state and federal and local government that have helped us. Yes, it were honestly a little slow to respond 4 or 5 weeks ago. During the last 3 weeks, we've seen a dramatic difference from the governor. Of course, the judge has always been, like everybody else, on the ground trying to do everything we can. But certainly the resources that we've been asking for in the last several weeks are coming and quite helpful. We have 3 Department of Defense teams down here that really help the physicians and the nurses a lot. So are the resources that we need, are we getting them? Yes, we are. Are we afraid that we'll run out of ventilators? No, we're not. Is there a theory that we were going to start restricting certain treatments to only a certain subgroup of the population? Because if you're too old, we're not going to give you a ventilator, what have you. That's obviously misquoted and untrue. Dr. Vasquez, my counterpart in Stark County, was misquoted and misunderstood when he made the news by saying that an ethics committee was to be set up so that we could evaluate which treatments would be available to certain people. And that, of course, got turned into, oh my God, the doctors are deciding who's going to live and who's going to die. The reality of it is that in Stark County, they have a 40-bed hospital while we have 2,000 beds. In Stark County, they have 7 or 8 doctors while we have 1,500. In Stark County, the hospital has 0 ICU beds while we have 225. The situation is vastly different. And so they're faced in 3, 4, 5 helicopters that were landing every day to transport folks, because they couldn't transport to the McAllen area, we were packed. So they were transferring folks to San Antonio in helicopters. And the question was, a lot of these folks were end stage, very sick, octogenarians, 80, 90-year-old folks, skilled nursing facility folks, demented folks. And the question was, how can we talk to the families and give them the big picture so that the family can make a more humane decision about the folly of transporting their loved one 300 miles when the probability of survival is 1%. And so by the ethics committee that would evaluate what would be the best way to approach families, not just a treating doctor, but as a system, as a hospital system, so that they could give the information to the family members and say, we know your family member is loved and cherished and deserves everything, but this is what it's going to entail. He's going to die far, far away from here. You're not going to see the body for 3 or 4 weeks because it'll be frozen. Transport back here will be quite difficult. Chances of survival are 1%. Every part of his body will be invaded by a hose and a tube. His ribs will be broken. He or she will be electrocuted, and his chance of survival is 1%. Do you really want to put your 88-year-old father into the situation? Once you explain it that way, most people would say, absolutely not. He's lived a good life. Let him meet God here on his own terms. In fact, is there a way we can take him home? So most people would go that route. So that was the whole idea of ethics committees, which already exist anyway. So back to your last question, which my understanding is
if you're encouraged by vaccines, a potential vaccine.
Yeah, about the optimism. Mm-hmm. And so there are 4 or 5 things that I think demonstrate for me optimism. On the top would be vaccines. I think the public needs to understand that when you look at a global system, when you look at a global healthcare system, when you have a disease like we have now that is a virus, as you know, we do not have very significant antivirals. We have remdesivir, which extends the stay in the hospital by 5 days. But what does that mean? I'm sorry, it diminishes the stay in the hospital 5 days. What does that mean? I don't know what that means. Certainly, the less you're in the hospital, the better you are. But that's the best that we can do, is to decrease your hospitalization for 5 days. You know what that means? That means we don't have a cure for it. And so if you don't have a cure for something, you have 2 ways that the global system, healthcare system can work. You can do what a lot of the European countries have done, including Sweden, or you can do what most of the rest of the Western culture has done, including the United States. And one way is that you say, we're going to let things run its natural course. We're not going to close the school downs. We're not going to isolate people. Everyone's going to go about doing their business. We may restrict a little bit of dining and what have you, but in general, life goes on. Those that are frail, those that are weakened, those that are at risk, they'll die. They'll die because they're going to die either now, or they're going to die 3 months from now, or a year from now. So let's take our hits now at the beginning, so we don't have this tremendous impact, and let's let the community get infected, because most people will not die, and you'll get a herd immunity. You'll have as if everyone got naturally vaccinated by getting the virus. So that was one system. I'm not here to pass judgment on them. That's just a system, and you can argue on its behalf all the time. I mean, let's be honest. If you're 90 years old and you're still walking 10 miles a day and you need a liver transplant, you're not going to get it because you're 90. And if you need a liver transplant and you're 50 years old and you keep drinking, you're not going to get it because you're drinking. So we have restricted healthcare for a long, long time because of the resources that are available based on the most good for the entire community. So just because people were not willing to do what we usually do doesn't mean it's bad. That's just what they chose. The other big dichotomy or bifurcation on global systems with pandemics is what the United States chose. We didn't choose to let the frail die and let's get herd immunity. We chose, no, every life, every human being, it doesn't matter if you have a tracheostomy and a PEG tube. It doesn't matter if you're demented. It doesn't matter if you have fecal incontinence, urinary incontinence. It doesn't matter if you're a ward of the state and you live in a nursing home because there's no family members left. We're going to do everything we can to save your life. A lot of people will argue, well, if you can't eat and you can't breathe and you pee and you poo on yourself and you have no family and you can't think and you're fed artificially and you live in a nursing home, what kind of quality of life is that? But we didn't question that. What we did is every single person is of immense value. When you take that approach, like the United States did, then the flow effect of that is that you have to establish systems that are going to save as many lives as possible, all lives, with the end goal of the vaccine. So you can either go with herd immunity from natural immunization or a vaccine. So the global experts felt that within a year to 18 months, there would be a commercially available vaccine that would be able to give us herd immunity, if you will, by vaccination. And so that's a route that we chose. So October, November, China, maybe September, the Valley, March. So what do we have? October, November, December, January, February, March, April, May, June. So we're at 10 months. So 10 months later, 10 months down the road, we're beginning to see that vaccinologists tell us that they have vaccines. Right now there are 3 companies, soon to be 4, that have already showed in the laboratory that they can elicit the immune response, that have already showed that it's been safe on whatever cohort animals that they're using. And now they're going to phase 3. Phase 3 means that we're now going to introduce this vaccine into human volunteers. And we're going to do that in a very controlled way. There, 2 of the leading companies are here. Dr. Joel Solis at Valley Arts on 10th Street is one of the lead investigators. And he has approximately 2,500 people that will be participating in this vaccine program. Yesterday was the first person, but it sequentially during the country. We don't start here in the Valley until I think Monday. I'm the lead investigator in another vaccine that will start in December. So there are different vaccines, different companies, which is good because each one has a different mechanism that it works.
Sure.
So you may want a hammer, you might want a screwdriver, you might want a drill, or if you're in war, you might want a grenade, you might want a machine gun, you might want a handgun, you might want a bazooka. So there are different tools to achieve the same goal, which is to kill that virus. And so this coming week for the Valley will be very, very neat that we're having people that are actually being vaccinated. So you'll get a vaccine and then you'll be getting blood drawn, depending on the study, 2 weeks, 1 month, 2 months, what have you. And you'll be measuring to see if you really do have an immune response. At best, the objective of the vaccine is to be as good as at least 60% decrease in getting the infection. So at least 60% of if you have 10 people and 6 were vaccinated, instead of 10 getting it, only 4. That's a threshold that traditionally vaccinologists have used. We're hoping that some vaccines will be better, 70, 80%, but a minimum of 60% is kind of the threshold amount. So there is light for optimism, although we don't know what the results are at the end. With every ray of light, though, there can be some rain. We don't know yet how long this immunological response will be. We don't know if you'll have to be getting boosters like you do with DPT or tetanus, or if it'll be forever like you do with the zoster, with the herpes vaccine. We don't know if this virus won't change, won't mutate, and so then what we're using now won't be effective anymore. And so only time will tell how long immunity, if we can get it, how long immunity will last, whether it'll be good for a couple of months, a couple of weeks. We have several cases now, people that have been infected, like myself in the past, get reinfected. And so is it because they were only good for 3 months? Is it because when they got sick, they only got a small response because their infection wasn't as bad as those people that get a big response? We don't know yet. This is a novel virus, a new virus. But is there hope? Of course there is. Is it a good scenario? Absolutely. Is there room for optimism? Of course there is. So I think that besides the vaccine giving us a little sunlight at the end of that storm, we have a couple other things that I think are helpful. We certainly know a lot more now than we did a couple of months ago. We know that if we use steroids, if we use anticoagulants, if we use large doses of certain vitamins and immune-enhancing agents, that it's very helpful and helps survivability. I'd like to warn the audience that every day there's a new video about the latest and greatest silver bullet that's going to kill the virus. And I hear it every day, and from my own white lab, colleagues that say if everyone's on hydroxychloroquine and zinc and the Z-Pack, you're going to live. If everyone takes the budesonide inhalers, as a doctor in West Texas was saying, I have not lost one patient. So let me just warn the audience of the following. Number one, there are no silver bullets in medicine. There is no 100% of anything. There's no 100% of people that die. There's no 100% of people that live. There's no 100% that anything is going to cure you. So when you hear people standing and saying, 100% of the people I treat did not die, this is the absolute total cure for this disease. I would question it. If you see doctors in videos announcing how effective the treatments are, there's groups of 10 or 15 of them, and nobody is wearing a face mask. So I would just caution that in the spirit of hope and optimism, that we're not falling into the magic powder that just, quite frankly, it's much more complex than that. Every silver bullet that I've heard, I used myself when I was sick, when I had COVID, and I've used it on my patients. And I have plenty of patients that got very large doses at the beginning of their diseases of all the medications you've heard of, hydroxychloroquine, steroids, and guess what? Some of them have progressed and they've died. So be aware of that. What else is there room to be optimistic about? Well, we have a vaccine that's starting. We can certainly have more tools than we had before that we know are helpful. We're getting the resources that we've been asking or getting more. There's a tremendous cooperation amongst the hospitals, the health department, the physicians. Like any other industry, healthcare is not immune to competition. And so although competition is good, it makes us better, sometimes competition gets in the way of what's in the best interest of the patient. And so what I've seen is that never before in the 30 plus years that I've been a physician has there been such a collaborative effort from all the stakeholders. I know I sound now like I'm an administrator, but I've learned these words, the stakeholders, right? I thought I'd never used that word in my life. I have a collaboration of the stakeholders that are saying, let's put our differences aside and let's do what's in the best of the community. And so I'm certainly seeing that, and that's very, very encouraging, very optimistic about that.
If we can collaborate effectively, as you mentioned, you've been a part of many big discussions as the Hidalgo County Medical Authority. Would you be able to just share some of the discussions on how to best approach the going back to school issue? That's a big subject right now, a hot one. A lot of parents like myself are trying to figure out how we're going to do this.
That's a really good question, and I can only refer to Hidalgo County. I know that different parts of the country, different parts of the world have a different scenario. And so there are some parts of the world and the country where schools should be open, and they are. And there are some studies that show that children tend to get a lot less sick and transmit less. There are some studies that show the opposite, that children can transmit, they do get sick, they just don't die as often. There are some studies that show that it makes no difference whether the school is open or not. And there are other studies that show the opposite. So for me, my decision, my recommendation to elected officials and the order that I drafted, because as a health authority, I'm the one who has the authority to do so, against our state elected officials' wishes, it was very simple. We have approximately between 350 to 500,000 people in Hidalgo County, population maybe 1.2, 1.3 million. About a third to 40% of folks are somehow involved in education. They're either involved as bus drivers, school teachers, coaches, vendors, suppliers, students, the families of those students, mom and dad and siblings of those students. So we have 30 to 40%. Let's for the sake of multiplication, I use the number of 500,000 people that are involved. Okay, so if we had, at the time the decision was made, approximately a 20% incidence of those people tested that were being positive. So if you tested 100 people, 20 would be positive. So if you tested 10 people, 2 would be positive. So if you tested 20 people, 4 would be positive. So if you tested 500,000 people, 100,000 people would be positive. So all of a sudden you have 100,000 people that are hanging out, being together, being in proximity, 100,000. Of those 100,000 people, 20,000 people would end up getting so sick that they would be in the hospital. That's 20,000 people. Of those 100,000 people, approximately anywhere between 1 to 2%, in our case a little higher, would result in death. So we're talking about under 3,000 or 4,000 people dying. So we have right now approximating 500 people dying. We are busting at the seams with, today was only 900 people, but we're having around 1,000 people. So we're busting at the seams with 1,000 people. Imagine having another 20,000 more added to the hospital.
I can't.
Imagine instead of having 30 people die a day, also we're gonna have 60 people die a day. So for me, and I was criticized by a lot of my colleagues, not only globally, also nationally. I've been going on so many national news shows and received a lot of criticism. My response has been quite easy. If your hospital resources are available, or you can handle those surges in patients, those surges in deaths, by all means, absolutely. But if you're going to already overload an overloaded system, throw in a little hurricane just to put a little salt and pepper on it, you're just looking for tremendous amount of problems. And so going back to school is a decision that will be continuously reevaluated, and the data of hospital availability is going to be the primary criteria by which I'll recommend when it's safe to go back to school. And so, although a difficult decision, I mean, if you don't know how to swim and your child goes overboard on the boat, you don't know how to swim, but there's no question you're going to jump in.
Yeah.
So that's kind of the way I felt about that decision.
We're all learning every day more and more, and we're looking to you, our health experts. I cannot thank you enough on behalf of our Socialife family for being so generous with your time for this life-saving mission that you've been on for quite some time, for painting a real picture of the situation here at home. We thank you. And
my pleasure, Martha. My pleasure. I'd leave you with one thought. We're a sophisticated group of people. We have a medical school. We have major universities represented here. We have a liver transplant system. We have a kidney transplant system. We are a mecca of all South Texas, south of San Antonio, for medical care. We have over 1,500 doctors with all the subspecialties from around the world. We have 14 hospitals, 4 of the largest hospital systems. We're not in the middle of nowhere, limited to knowledge and resources. Yes, we're number 1 or 2 in obesity, poverty, diabetes, access to healthcare. Yes, we have a population that before the COVID virus is already sick, but we have the resources intellectually and the resources, human resources and physical resources to address these issues. And yet we've been overwhelmed. And we've been overwhelmed not because of a lack of effort or lack of insight, a lack of supplies, a lack of love, a lack of compassion. We've been overwhelmed because of the exponential amount of people that show up at the door seeking for help. And since pandemics have been around since the onset of recorded time, from the Romans onward toward the most famous pandemics of all in 1340, the Black Death, the Yersinia pestis, the bubonic plague, which, by the way, is still present today. 800 years later, this pandemic, this bubonic plague that killed 20 million people in 1 year, 1/3 of the population of Europe, is still present 800 years later. We have 1,000 to 2,000 people dying from Yersinia, from the Black Plague in Africa every year. So this virus is going to last as long as human beings last. This virus is not going to go away next year or 1,000 years from now. As long as we have human beings, or 100% vaccination, or 100% herd immunity, this virus will never go away. And how has every generation been able to successfully beat something that is incurable, whether it's a lack of antibiotics with a bacteria in the 1300s to a virus that has no antivirals? It's always been the same formula. It's called quarantena.
Mm-hmm. I'm familiar with it. Mm-hmm.
Quarantine. So what people would do, that I'd see a sick person and they had to stay home for 40 days, or they would get stoned, or they would get lynched. So the solution has always been sick people have to stay at home. Because this virus is so tricky, that's why it's been able to propagate. It tricks people into thinking there's nothing wrong. I feel great. I'm young. I'm not going to die. The average age of the person in Hidalgo County is 29 years. That's the average citizen of Hidalgo County. When you're 29, you're so hungry for social interaction. It's part of the issues of being at 29, as opposed to a guy like me. Man, I love going home. I love being alone. Being alone is addicting to most of us that are old. But young people, they love socializing. I'm not criticizing them. It's normal. It's healthy. But when you put that criteria in, when you put those specific facts in, it's a recipe for disaster. So I want to remind the audience, and this is my message, the number one reason why I've been giving it so much time is to get this message out. And that is, in 14 days, the virus will either kill you or you will kill the virus. In 14 days, the virus will no longer be able to jump and attack your brother and your sister and people at home. So you need to stay put. stay put for 14 days, socially isolate for 14 days. And if everyone does that, I'm not talking about 40% of people, 50% of people, 80% of people. I'm talking about 90% of people plus. If you stay at home, if you socially isolate, you don't need the government telling you what to do. We're all adults. We all love each other. You don't need a law. You don't need punishment. You don't need a fine. You don't need handcuffs. You need to have some social awareness and love for your neighbor and say, if I stay at home for 2 weeks and everyone does it, this is going to go away. And that's my message to the audience.
That's a wonderful message. Let's work together and take care of each other.
Thank you so much.
Do you have the token of appreciation that we sent you in your hands?
I don't. I have it in my car because I love coffee so much.
That you left it in the car. Okay, I'm going to ask then for a little fist bump as I put my Socialife mug to you, to that hope that we get to that other side together. Thank you, Dr. Melendez, so much from all of us here at Socialife for the contributions that you're making to keep us all as healthy as possible and giving us that fighting chance. It's been wonderful having this conversation with you. Wish you all the best and look forward to having many more conversations with you in the future if you'll allow us.
I'm at your call. How long have you been a journalist, Martha?
It's been 23 years, approximately.
And you realize that I've been watching you for that long, and that the community is always extremely grateful for the way you disseminate the information and educate us. But I'm going to ask you a question. Do you think that the community has gotten more out of you, or do you believe that you've gotten more out of the community?
I have learned so much from everyone here at home, and I continue to. You know, it's a beautiful thing to be surrounded with such a passionate community that cares, and I really hope that they'll listen, because right now we all need to be doing our very best to help each other and get through this. You know, I really have a great love for my home here in the Valley, and I want to see us get to that other side, Dr. Melendez. And I
think we all do, but I think you're just too humble to say this. But I'll tell you, as an ex-soldier, when people say thank you for your service, the way you're saying to me and I'm saying to you, I know that I have received so much more by being in this position and doing what I'm doing than what the community has received. I'm eternally grateful for everything that I'm getting back by doing this work. And so I thank you for the opportunity. Thank you for what you guys are giving back.
Public service is a beautiful, beautiful way of living life, you know? It's a great contribution. Thank you, Dr. Melendez, so much for your time.
All right, see you later. Thank you.
Take care. Bye-bye. Salud. And coming up, we're going to get out the vote. How we do that during a pandemic, we're going to talk to an organization called ACCT. So don't go away.
We give 100%. We do whatever it takes. We sweat the small stuff. Every day, every hour, for 20 years. To ensure that every child in every community we serve has a chance to succeed, compete, thrive. This is just the beginning.
Rio Bank would like to take this opportunity to tip our hats to all the hard-working folks in the farming and ranching business. Your jobs can be really tough, but getting an ag loan shouldn't be. Rio Bank offers agriculture loans that are here to help you make your job a little easier. From farmland to cattle, we've got your back. Come speak to a Rio Bank representative today to get the ag loan you need to keep growing.
Rio Bank, your kind of bank, your kind of banker.
Getting to the polls, how difficult will that process be this election year? Well, here to offer on ways that they're trying to make it a little bit easier is Mr. Carlos Martinez. He is the acting director with an organization called ACT, the Advocacy Alliance Center of Texas. Thank you, Mr. Martinez, so much for joining us. How are you doing?
I'm doing well. Thank you so much for having me and letting me talk a little bit about the voting process.
It's a big election year. We know that, and we know that you offer support to our community by educating and offering them the tools they need to get involved in the electoral process, because that's so important, Mr. Martinez, especially right now.
Absolutely. We have a lot of things going on, unfortunately, and we got to remind people that it is an election year, and it's very important that we come out to vote. At ACT, we're a nonprofit, nonpartisan organization, so we don't tell people who to vote for, but we always work on letting people know about the process, about voter registration, and how to find the polling locations, and keeping people up to date as to what's going on with the elections, so that way everybody's informed and knows what to do whenever voting comes.
How are you doing that? How are you getting your message out and offering your assistance to members of our community who perhaps have never voted before and don't know how to go about the process, Mr. Martinez?
Correct. So in the past, we had been going to different events in the community, had voter registration drives. Unfortunately, things have changed because of COVID-19. However, we still have different resources that we have online. We have a tool where people can actually check to see if they're registered to vote. We work closely with the elections department in Hidalgo, Cameron, Starr, and Willacy. And so throughout the years, we been working with them, and they helped us develop this voter, what we call it voter lookup. So that way people can find their information and see if they're registered to vote. And if they find out that they're not, or maybe they need to update their information, or they just turn 18, we have the tools there so they can register to vote. Of course, in Texas, you cannot do it online, but they can print out their form or get one be sent to them by the elections administrators. And so right now, with everything going on with COVID-19, we're trying to be creative as to how do we reach out to people. Last week, I called a couple of the elections departments. And so what they're offering as well is if people were to call and they need to update their information, they will send you a voter registration card that you can just fill out and put it in your mailbox. And so right now, we're working hard at letting everybody know that if the election is coming, and in order to participate, we all need to register to vote. So if you haven't voted in a very long time, and I'm talking about more than 4 years, or you recently got married, changed your name, or changed any information regarding your address, or any type of information that you needed to maybe update your driver's license, you also need to update your voter registration card. So it's very important that we do it. The last day to register to vote is October 5th.
That's right.
That hasn't changed. And so if we're not registered by then, unfortunately, we won't be able to participate. So it's very important that we start early. And like you said, if they have any questions, they can always feel free to call us at 956-664-2228. Again, it's 956-664-2228. And like I mentioned, they can always verify they're registered to vote at our website. That's actnow, AACTNOW.org, O-R-G. So if there's anything that changes, we'll make sure to let everybody know through our social media, our website. And if you're not sure, you can always just give us a call and we'll let you know if things have changed.
Well, we appreciate you coming and sharing this message because it is an important time. Everybody should exercise their right to vote. We want everybody to be a part of this very important process. It's very important. Thank you for the work that you do with ACT, and we wish you all the best. Thank you.
Thank you.
And coming up, it's all about the flavor. A red snapper seasoned to perfection by our friends at Santa Fe Steakhouse. Don't go away.
This is a generation-defining moment. And like every such moment, we will be defined not by the challenge itself, but by what we do now. During this unprecedented time, know that we at UT Health RGV will always be here to serve the entire Rio Grande Valley, to save lives, to keep us safe, and to preserve our community.
Thank you.
You are our heroes.
That fish looks like it's been cooked to perfection. We thank our friends at Santa Fe Steakhouse. We also thank special guest and Hidalgo County Medical Authority, Dr. Ivan Melendez. We also thank Mr. Carlos Martinez with the Advocacy Alliance Center of Texas, Mr. Imam Noor for his message of hope, and Deutsch Deutsch. And you for joining in on the conversation. We're so thankful to have you as a part of our Socialife family, and we leave you now with the art of socialifing.